First guest, Erin Ash, a genetic counselor at Stanford Hospital's Bennett Cancer Center. And Erin will show us a new breast cancer risk assessment tool that's computerized. You use this tablet for it, huh?
We do. This tablet is available at all the screening mammography sites at Stanford Hospital, including our mobile mammography van for women to use when they come in for their screening mammogram appointment.
Now, this goes a little bit beyond your questionnaire of the past.
It does. In addition to asking questions about a woman's medical history, it also asks about her family history on both sides of the family and her father's side of the family. This dispels one of the common myths that breast cancer on the father's side of the family is not important.
That's true.
Equally.
I've seen so many questionnaires, and they focus so much on your mother's
They do.
Medical history and, whether or not she's had breast cancer. So this one will get into the paternal side.
Correct. Both the maternal and paternal side of the family. So asking about grandparents, aunts and uncles and cousins, if there are any cancers in addition to breast cancer that also occur that play a role in guiding a woman's medical care.
Now this all makes sense to me, but then I see what you get back and I'm amazed by what you do. I want to show folks some of the data that comes back to you. Now you're a genetic counselor, so you can make sense of this. What are we looking at?
So what we're looking at is a woman's pedigree, a diagram of the family tree, and it is showing the individuals who've been diagnosed with cancer and the age, and determining what the likelihood is that she could carry an inherited predisposition to a certain type of cancer, for example, breast cancer.
Now there's another screen that comes back to you with this data.
This is documenting her risk for certain types of cancers, including breast cancer. That information is critical for a woman and her doctor so that they can perform the appropriate screenings for her.
If you've had another kind of cancer, how much does that boost your risk of breast cancer?
It depends on the type of cancer that it is. Most other types of cancers, for example, colon cancer or cervical cancer, do not increase the risk for breast cancers. It's only specific types that we see either in the person themselves, in the family, that raise our concern.
Now, there's one other screen we want to show folks, and this one, I tried to make sense of it, and I said, I'll wait for Erin on that one.
What this screen tells us is a woman's lifetime risk for breast cancer and her 5-year risk. The lifetime risk is critical to determine if a person meets criteria for screening breast MRI as part of her yearly evaluation. The 5-year risk lets us know if she meets criteria for preventative medications that can lower a woman's risk of breast cancer by as much as 65%.
Now, you're talking about breast MRI?
We're talking about breast MRI, that's correct.
Now, I understand that most insurance companies require a mammogram first. Would this assessment in some cases make it okay for a woman to go directly to MRI if she has dense breast tissue, for example?
We wouldn't be able to tell if she has dense breast tissue without a mammogram. So yes, mammogram is an important first step, and it's much more widely available and less expensive way of assessing the breast. Then, based on a woman's mammogram results and her family history, she may meet the American Cancer Society criteria for screening breast MRI. So it's a combination of all the information together.
What percentage of breast cancer cases are in women with no family history?
The vast majority, about 90% of breast cancer, is sporadic. It occurs out of the blue for the first time in that one person. And it's only about 10% that's hereditary or passed on through families.
Do you do any assessment of recurrence risk?
I do not personally. Recurrence risk is based on the type of cancer a person has had and that particular treatment plan. So that would be best determined by an oncologist.
And there would be some DNA testing, perhaps?
There can be DNA testing that's done for the oncologist to determine her recurrence risk. In my particular area, we can do some DNA testing to determine if there's an inheritance for that person's cancer. That would let us know if she faces higher risks for other types of cancers, like another breast or ovarian cancer.
Okay.
But those are two separate things.
Yeah, it gets very complicated, which is why your counseling can help us sort it out. We have a break, but I want to ask you, can you leave us with just a few things that are definite risk factors you want women to keep in mind?
The Definite risk factors to keep in mind are a woman's age. You know, the longer that we're exposed to our own natural hormones in our life, our risk for breast cancer increases gradually. Other than that, if we have a family history of young women who are diagnosed with breast cancer, women in their 40s or 30s, if we have a family history of ovarian cancer, those are questions a person should bring to their doctor to determine if she faces a higher lifetime risk.
Thank you so much, Erin
You're
Ash.
welcome.
I think the message is don't ignore those risk factors.
Absolutely.
Up next, lots of talk about the harmful ingredients in cigarettes.